Hey guys, this is Michelle Trace and welcome back to my channel. If you're new here, welcome. My name is Michelle. I'm a registered nurse and a nurse practitioner student. And this channel is basically all about my life as a nurse, as an NP student, and everything revolving around it. If you're an oldie, you're an OG. Thank you for joining the family, subscribing to my channel, basically supporting me. I love you. I love you. I love you. So, this is like a milestone. If you've been watching me for a couple of months or years, if not, if you haven't been, I'll give you a quick brief update. So I graduated nursing school in 2018. I started off as a med-surg trauma nurse for 2 years, worked my way up, became a trauma ICU nurse for another 2 years, and I recently moved to the emergency room a couple months ago for specific reasons, which I discussed in the previous video. But this marks not me giving 2 thumbs up, 6 months as an ER nurse. Woo! And I'm gonna give you guys my honest, truest thoughts. Now, I've expressed again in previous videos that I decided to become an ER nurse because at the moment it was what worked for me. It was a specialty that worked for me at the time. I'm working part-time while I'm balancing school, which has become more and more hectic. So I decided to work part-time somewhere, and this part-time job gave me benefits, which worked out pretty well. So I do get some reimbursement. So they do pay a little bit of my tuition in that aspect, and I still get some insurance benefits and stuff like that. So everything worked out well, and I'm working as an ER nurse. However, I would be honest and tell you guys this is not the specialty of choice for me. It's more of what worked for me. So I was kind of nervous getting into this specialty because I knew that I don't really have I felt like I didn't have the personality to be an ER nurse. I enjoy being in the ICU and, you know, just doing what I do in the ICU. So being an ER nurse felt like it was just on the other spectrum of life. And I've gotten lots of comments about how ICU nurses don't transition well to the ER. And basically, you know, I've gotten lots of looks and comments being that I left the ICU to be an ER nurse. A lot of people were just like, what? Like, but it is what it is. I can't keep explaining myself to people sometimes. Like, you just have to do what you got to do what's best for you. And that's really what I did for myself. So it's been 6 months. And I feel like I've also expressed in previous videos that, you know, I wasn't really feeling it when I first started. I was like, I'm just doing it because I have to. I didn't really like it and stuff. I just didn't like the workflow. I kind of hated it, to be honest. But it's been 6 months, so I'm giving you guys what I feel right now, being that I'm not on orientation. I'm more on my feet. I already know what to do. And I would say, despite the fact that this is not the specialty of choice for me, I would 100% agree that it's helped me become a better nurse practitioner. It will help me become a better nurse practitioner. It's helped me become a better nurse practitioner student. And I didn't realize it till I started working. So this is what happens when you just follow God's plan for you. And you know, when He makes a detour, you follow the detour. Because you never really know like what you're learning in different seasons of your life that might help you in the future. And this is one of those examples. So just for like, to give more context, like in the ER, patients coming in, you don't really know them from anywhere. There's no report given to you. If it is, it's just like a little 2-second report from the paramedics, but you're coming in and you have to discover what's going on with the patient. So you have to know what the chief complaint is, get a history of present illness, get the history, family history, medical history, social history, allergies, medication, like you get everything. And then even from there, you as a nurse also have the autonomy to start putting orders in and doing specific lab tests and coordinating things and getting some information about what's going on. And you know, the doctor also then puts the order or makes the decision of if the patient needs this medication or needs to be admitted or whatever the case may be. So that aspect of nursing care, I never got that working inpatient in the ICU or in the regular med-surg floor. So that was a new thing for me. And now that I'm a nurse practitioner student, I'm seeing how similar it is. Like being a provider, you go in and you meet a patient, you kind of figure out what's going on with them and anticipate what the next plan of treatment is for them. So that for one helped me 100%. So for anyone that wants to become a nurse practitioner, or I would say maybe a physician assistant or whatever it is, and you're a nurse, in the ER, you get that experience, and that experience would be so helpful in practice. So I would say that, yes, it did help me a lot, and it made me more confident in talking to patients and being more knowledgeable about what the plan of care is. And even as the emergency room nurse, you do get to practice that skill set as well. So that's something that I learned. And I would say it was a good benefit. So yeah, whatever. I guess it was cool. So yeah, and another thing that I learned is that being in the ER, I do get more exposure to different kinds of patients. The hospital that I'm working in is relatively small, so the patient population are pretty much the same. But I do know that if I worked in a bigger hospital or in a more populated town, I'll probably get more variety of patients that I'm seeing. That exposure is helpful because it helps you tap into different nursing skills that you probably left in nursing school. And now you revisit them. Like, let's say I had a patient that was 2 years old with seizures. I don't really get 2-year-old patients in the ICU or at my other jobs, but it helped me tap into my pediatric nursing skills that I learned in nursing school. And the same went with like a woman that was like pregnant and all that stuff. So I do think that working in the ER gives you that ability to work with different patients across all, you know, lifespan and population and demographics and stuff. And that helps you continue to learn more and gives you more courage to tackle different kinds of patient cases that you might come across in the future. I do like the flexibility of work shifts. Granted, I still work 12 hours, 7 to 7, but the fact that you have the opportunity to come in at 9 and 11 and 3, it does help. And I guess for anyone who wants to be an ER nurse, you do have that opportunity to do that. And if it helps with your schedule and with life and stuff, I guess that's really helpful for you. Another thing is also, I like the fact that you're never really alone. Everyone works together and the teamwork is amazing. Well, where I'm working in, the teamwork is amazing. If I ever need help, there's always someone who comes in and helps willingly. We do have floating nurses who just jump around if they need help for anything. And I think just getting that support system was really good in my transition. One of the biggest fears for nurses is that they go into a new unit and they just feel like they're going to do everything by themselves and no one's really going to help them. And I think when I was welcomed with that support and help of everyone else, did make me feel more comfortable, and it helped me assimilate into this new environment quicker. So that's one thing that I'm enjoying so far, to be honest, in the ER. And another thing is, I mean, I like my unit. Everyone is nice, everyone's respectful. It's definitely a shift because at my previous unit, there was a lot of cattiness, a lot of gossip, a lot of toxicity in the work environment. Granted, I always distanced myself away from it, so I never really was into it as much, but just observing in this new environment is less of that stuff. It's less of that stuff, and it's relief to come to work and not have to deal with all of that stuff, man. Like, working in a toxic unit is crazy, and if you're involved in that kind of stuff, it's just mentally draining. Like, what are you doing? Like, don't you have a life outside of this job? Try not to be rude, but yeah, I just feel like my new unit, everyone's respectful and nice. Really, I would say though, we can work better on the diversity of the workers. That's all I'm gonna say. But besides that, everyone's been nice to work with. My transition has been bliss. Yeah, continuously learning. I feel like everywhere there's always a room for learning, room for growth. You just gotta tap into that, and I think I've learned a lot. And so far, my time here has been okay. My honest truth is still, ER is not my favorite specialty to work in. I really just still not a fan of the workflow, the fact that I can come in, the patient comes in and leaves, and just relearning different people, and the turnover. I'm not really a fan of it. I really am not. I'm sorry, but so far just working there has been good. It's worked out for my schedule. I'm less stressed, I'm less burnt out. I have more off days to myself to focus on school and other personal things, so it's worked really well for me. I did post a video about different ways to figure out if a specialty is for you, and I feel like if you have the personality of an ER nurse, working in the ER would be an amazing experience for you. If you're pursuing a higher degree, working in the ER is also a great way to learn, great way to start. It's great. It's great. And that's all I'm gonna say. So that's my 6 months in working in the ER. It's my little update. So far so good. I'm not drowning, I'm not suffering. And that's really the most important thing. Like, I think it's really, it's helped me become a better nurse practitioner student. I think it's going to help me become a really good nurse practitioner. So I can never deny that fact. I just have to get used to this workflow, this lifestyle, this specialty, which is not entirely bad for me. It's been a great journey so far. I still miss my ICU. I still miss my inpatient, but that's neither here or there. But that's pretty much what I'm going to say. And we will check in a year time, I guess in the next 6 months or so. We'll check in and see how my life is, if I like it, if I don't like it, if my thoughts have changed, if my opinion has changed, if my stance has changed. But in the meantime, stay tuned. If you enjoyed this video, make sure you give it a thumbs up. Make sure you like this video, comment your thoughts, comment your questions. Most importantly, make sure you subscribe and join the family. Make sure you hit the notification bell so you can get notified every time I post. And until then, I'll see you in my next video. I love you guys so much. Bye.